So let's go to our next topic out of the three, Perioprotect. Does anybody read Hygiene Town? Any show of hands, anybody get that? Hygiene Town? It's related to Dental Town. Okay. In fact, I think it's edited by one of our past speakers at the Tricia O'Hare. Her is the one who is the main editor of the magazine. So they have an article that they did on innovation, and it talked about Perioprotect, and it talked about the guy that came up with the system. And what he said is that his mother had gum disease, and it was awful. When they had periodontal treatment, the teeth hurt, they were longer, they were cold sensitive. It's the normal when you're trying to talk about the negatives of standard periodontal treatment, what they usually throw at you. This is nothing new. So he said, poor mom, I got to come up with a better way, which I understand. But after many steps, I developed a special tray, which was able to overcome clavicular flow and deliver the medicine to the source of the infection. So came up with these trays. It's a tray system to control periodontitis at home, which is, interesting that you buy these trays and you can do it at home to control your bone loss or your periodontitis. And it's up to the clinician to pick what medicines that they put in, medicaments they put in the trays. It's usually either an oxygenating agent, which is like a cleanser, which some of the, Colgate has in some of their products, or some type of antibiotic is what. They kind of leave it very vague exactly what they put in the trays because they want you to learn more about the product and go to one of their courses before they tell you the magic answer. Also, they want you to buy the trays from one of two labs. They don't want you to try to make the trays on your own. So it's a special tray, according to their literature. And what it does is you put on the tray and it pushes down the medicaments into the pocket. That's Perioprotect. And what do they say about Perioprotect? This is from them. It may be delivered to the source of infection. It may help improve bad breath. It may whiten your teeth. And it may provide long-lasting results and reduce the need for gum surgeries. It must be may, because there's a lot of mays in this thing. It's basically to keep, because they don't know. There's not a lot of evidence, so they could just put maybe. There has been some clinical research done, and they definitely have testimonials, which I'll talk about, and some certification courses. So you have to go to them, pay to learn from them before you can do it in your office. There's been a couple studies, but the studies really don't compare to standard scaling and root planning. They just kind of show what Perioprotect does, some initial studies in the treatment of periodontal disease. And they have a lot of these testimonials. We know testimonials, right? Everybody's heard of someone coming in and saying, I used it and it was just miraculous, these balloon pants. It was just miraculous how the changes that occurred. It stopped bleeding in 2 days. It felt like a professional cleaning. This is from a patient every time I used the tray. So these are testimonials. These are just people that get to say what they feel about it. It's not scientific. It's just an opinion. Like Mark McGuire here. Everybody remembers Mark McGuire? Whose father's a dentist, by the way. Mark McGuire drinks milk and he got those big muscles, right? This is a testimonial. Mark McGuire was doing a lot more than drinking milk, as we found out later on, to get those big muscles. People see this, and what do they think? They think, I should drink milk, right? To be like Mark McGuire. They also do certification courses for the Perioprotect method, which they show you how to make the tray. They show you for the prescription to make the tray. They show you what the recommended medicaments are to be used in the tray. And they provide you marketing support, which is really the bottom line when it comes to it. You better be able to market good on a product like this. But let's look a little closer at it. What it did is it says it's FDA approved. Well, it's really FDA approved under the auspices of a fluoride tray. It was not FDA approved to treat periodontal disease. So that's a tricky thing when you see something that says it's FDA approved or patented. It may be under the use of something else, not under the use of to treat periodontal disease. Clearance did not determine that it's been proven to affect the treatment of gum disease, and has no real controlled studies that have been shown or published. And many studies, this gets into what we know, get into the fact that we know things are very difficult to get down into the base of the pocket through rinsing or irrigation. So lots of research has shown that that's a very difficult thing to achieve. So we get back to Doc here. Welcome back. How reliable is the source of the claim? Of course, the old studies were sponsored by the Perio Protect company. Have the claims been verified by another source? What do you think? No. Does the claim fit with what we already know to be true? No. Because we know it's difficult to get something to the base of a pocket, particularly by wearing a tray. So, let's look at the range. Where do you think this one's going to fall? Down toward the bottom. One step lower and you get balloon pants. So this is what we go. We still ask the same three questions whenever we're presented with any information or claim. So let's go to our last one. Let's talk about local delivery agents. Now, local delivery agents are different, and let's look at an authority. Everybody knows who this person is. Have anybody? He's spoken in his room, many times. This is Gordon Christensen. And I've spoken to you about some things that he's been saying in the past about the treatment of gum disease. One is that scaling and root planning should be incremental and proceed slowly over several months. I don't know about your patients, but I don't think they want months of scaling and root planing. Nor do the insurance company wants. They want it twice minimally, preferably 4 times. He wants you to rinse a lot. You rinse with chlorhexidine for a couple months, tooth and gum tonic for a couple weeks, Listerine, then chlorine dioxide, and then stannous fluoride. So you rinse a lot when you have it. You step one after the other. And then you alternate Periochip or Western Atrodox into pockets. You use Periostat. And since conservative techniques can be delegated to staff persons like you, it's a source of income as well as a service to the patient. So that's his response to periodontal treatment. So what's the treatment according to Gordon Christensen? Is a lot of products to be used. Now, is there any research that shows that this is effective for periodontal treatment? No, we know that there's not. I don't even know really what to call it, like the kitchen sink approach, I guess would be the most obvious way.